Welcome to the Med Madness podcast. Today we're diving into the world of cardiac arrhythmias and syncope. These conditions can be complex and challenging to manage, but understanding their pathophysiology and clinical features is crucial for effective treatment. It is important for medical students to understand these topics because they are common clinical presentations and can be life-threatening if not managed appropriately. In this episode, we will cover what cardiac arrhythmias and syncope are, their causes and risk factors, pathophysiology, symptoms, diagnosis, management, and treatment options. We will also present a brief case study to illustrate a real-world example. Cardiac arrhythmias are abnormal heart rhythms that can result from various underlying conditions. Syncope is a temporary loss of consciousness, often related to insufficient blood flow to the brain. Common causes and risk factors for cardiac arrhythmias include age-related degeneration of the cardiac conduction system, ischemia and infiltrative cardiac diseases such as sarcoidosis and amyloidosis, electrolyte imbalances such as hyperkalemia, and structural heart diseases and myocardial infarction. Let's dive into the pathophysiology of some specific conditions. First, sick sinus syndrome, also known as SSS, is characterized by the inability of the sinoatrial node to generate an adequate heart rate. Age-related degeneration of the cardiac conduction system with fibrosis of the sinus node is the most common cause. Next, ventricular fibrillation, or VF, is characterized by unorganized ventricular activity leading to a non-perfusing rhythm causing cardiac arrest. It often results from the degeneration of ventricular tachycardia. Finally, supraventricular tachycardia, or SVT, refers to a group of arrhythmias originating above the His bundle. AV nodal reentrant tachycardia, or AVNRT, is the most common form, caused by an abnormal circuit within the AV node with fast and slow pathways. Common symptoms of these conditions include bradycardia, fatigue, dyspnea, dizziness, and syncope and SSS, palpitations due to atrial arrhythmias, sudden cardiac arrest and poorly formed irregular waves on telemetry and VF, and palpitations, dizziness, lightheadedness, shortness of breath, chest pain, and syncope and SVT. Patients with SSS often present with symptoms of bradycardia and may have a bradycardia-tachycardia syndrome. VF typically presents with sudden cardiac arrest during acute myocardial infarction. SVT, particularly AVNRT, presents with abrupt onset of regular tachycardia, often in young patients. Diagnosing these conditions involves a combination of clinical assessment and diagnostic tools. An electrocardiogram, or ECG, is used to identify sinus bradycardia, sinus pauses, and sinoatrial nodal exit block in SSS, an irregular chaotic rhythm with absent organized QRS complexes in VF, and a narrow QRS complex tachycardia with buried P waves in SVT. Telemetry monitoring provides continuous monitoring to detect arrhythmias. Exercise testing can demonstrate chronotropic incompetence in SSS. Advanced imaging techniques such as echocardiography or cardiac MRI can identify structural abnormalities. Treatment varies based on the specific condition. For sick sinus syndrome, placement of a pacemaker is the definitive management, and rate control medications such as beta blockers can be used for persistent paroxysmal tachyarrhythmias. For ventricular fibrillation, immediate defibrillation is critical, following advanced cardiac life support or ACLS protocols, including CPR and defibrillation. For supraventricular tachycardia, vagal maneuvers and adenosine are used for stable patients, while synchronized cardioversion is indicated for hemodynamically unstable patients. Lifestyle modifications and preventive measures include avoiding triggers like excessive caffeine or alcohol, managing underlying conditions like hypertension and heart disease, and regular follow-up and monitoring. Let's consider a brief case study to illustrate these conditions. A 70-year-old male presents with fatigue, dizziness, and episodes of fainting. His ECG shows sinus bradycardia and sinus pauses. He is diagnosed with sick sinus syndrome. A pacemaker is implanted and he is started on beta blockers for atrial fibrillation. This case highlights the importance of recognizing the symptoms and promptly managing sick sinus syndrome to prevent complications. In today's episode, we covered the important aspects of cardiac arrhythmias and syncope, focusing on sick sinus syndrome, ventricular fibrillation, and supraventricular tachycardia. We discussed their definitions, causes, pathophysiology, symptoms, diagnosis, and treatment options. Early diagnosis and appropriate management are crucial in preventing complications and improving patient outcomes. Stay engaged with your studies and keep learning. Thank you for listening to Med Madness. Stay tuned for our next episode where we will continue exploring more about cardiac arrhythmias. If you have any questions or comments, please feel free to reach out.